Enrollment in Obamacare kicked off on Tuesday with the expected glitches and questions. Tonight, in our ongoing look at the new law, we consider that in 2012, the average hospital stay in the United States cost about $12,000. That's the most expensive in the world. Germany was next at only $5,000. It's a bitter pill for the sick, who often face the real fear of bankruptcy over their medical costs. Can a system that has largely failed to control costs for decades really change under the new law? Joining me now to talk about how Obamacare will impact hospital costs are Andrew Rubin. He's the Vice President of Clinical Affairs and Affiliates at NYU Langone Medical Center and the host of Healthcare Connect on Sirius XM Radio, where he has been fielding calls on day one of Obamacare enrollment. And Neil Shaw on OBGYN, based at Harvard Medical School. He is also the Executive Director at Costs of Care in Boston. That's where he joins us from tonight. Thank you both for joining us. I'm sure it was a busy day for you, Andrew, with all those calls, wasn't it?
It was really busy. People still don't get it.
I'm sure they don't, despite all the explanations that have been out there. Now, medical bills, as we were saying, are a very important matter for anybody who gets sick in this country. Medical bills are the leading cause of bankruptcy in the United States. Only 12% of uninsured people end up paying their hospital bills. The question I just asked, is there any chance that this new law will control costs?
It's a great question. I don't think it's going to lower costs. I think there's a lot of people who have these great expectations that healthcare reform, whether you're for or against it, will actually lower costs in this country. It's not going to. What we have a shot at doing is controlling costs. So seeing these escalations that we've seen over the years, where insurance premiums have been going up for people 10, 20% a year over year, I think that we'll see start to come down, and whether it be Obamacare or Medicare in general has launched some initiatives to try and get this under control.
So the speed of the increases may slow down.
That's the goal.
I want to talk a little more about costs in a minute, but Neil, I want to talk about choice too. The government is talking that we will see lower costs, or at least a slowing down of the increase in costs. But is one of the issues that insurance plans are going to limit hospital options and limit choice?
Well, I think it's important to be clear that the scope of Obamacare, the Affordable Care Act, is really just to give middle-income Americans access to a mechanism to get insurance. I think independently of that, because healthcare costs are rising, health plans have increasingly started to restrict choice in the sense that they essentially make it less expensive to go to hospitals that are less expensive for them and more expensive to go to hospitals that are more expensive for them.
But with Obamacare, we haven't talked that much about it, but the prices at hospitals can vary dramatically. A recent study of charges sent to Medicare found knee surgery at Baylor University Medical Center in Dallas costs $43,000, $852. A few miles away at Las Colinas Medical Center, the charges were nearly 4 times as much, $160,000. Is there anything in Obamacare that will change that? Because obviously whoever ended up getting that $160,000 bill is a lot worse off than the other person, no matter what their share of insurance they are.
Absolutely, and this has been one of the most confusing things for the people to understand in this country. Why are these costs so crazy, and why do they differ, across the street from one hospital to the other? It's a game that's been played for a long time by hospitals and doctors, for that matter, and the insurance companies. Charges don't really have a lot of meaning in the healthcare system unless you're uninsured and you're paying charges. It's a mechanism that hospitals and doctors use to negotiate with the insurance companies. So we at a hospital or a doctor organization need to set a charge that we can negotiate with the insurance company at and settle on a price in the middle. So if we charge more than a hospital across the street, it doesn't necessarily we're getting paid more by the insurance companies to provide that service.
It's like a lawyer who sues somebody and asks for a ridiculous amount, hoping to...
And you settle somewhere in the middle. Now Medicare, a little secret is Medicare pays if the surgery is the same, Medicare pays the same rate across the street from one hospital to the next.
They have a fixed cost.
Exactly. So it's up to the hospital to make it work on that payment.
You mentioned that people are still very confused about what's going on, and we sent our social media producer Hermela Aragawi out to see what people knew about Obamacare as today it came into being. Hermela, what did you find?
Thanks, Antonio. We talked to people in New York City today to get a sense of what they know about the Affordable Care Act now that it's the first day of open enrollment. Let's take a look. Do you know about the Affordable Care Act?
I've heard about it, don't really know too many details.
I heard of it.
Do you know about Obamacare?
I have it.
Kind of in the dark about that, to be honest with you.
You know about the open enrollment
No.
under Obamacare?
No.
Andrew, I know you have a radio show, so I imagine you come across this issue a lot. Why don't people know anything about the Affordable Care Act? And if this continues, how is it going to impact the success or failure of the law? And how is that going to impact hospitals?
Well, you have to remember, for the past several years, all we've really been listening to as we watch television and read the newspapers is the political battle that's been taking place. Is health reform good for this country or not? And we're talking about it today with the government shutdown. There hasn't really been a lot of discussion on what's actually in the healthcare law. And I think as these state exchanges go live, and we know today was a rough day enrolling millions of Americans in crashing systems. I couldn't even get on to the New York State Exchange to see how they were going to work. I think once people start to log on and see how they work, the information will start flowing and people won't be so scared of this thing. Remember, even before healthcare reform, people didn't understand healthcare that much. So this just made it a lot harder to understand.
Yeah, although, boy,
it's
there's
worth
been...
mentioning, too, I think, that, it depends on who you ask. There's something like 50 million Americans that don't have a mechanism to access health insurance right now. My 26-year-old brother is one of them. He just finished law school. He's not working for a big employer, and right now, the open enrollment is his only mechanism to be able to get affordable health care. So I think there's a very large segment of the American population that understands the direct benefit of this.
Yeah,
but there's also a large segment of the American population who, whenever you are going to make any kind of change in health care, immediately get concerned.
We've been addressing this for a couple of weeks here, and it's in newspapers everywhere, so it really is striking when Hermela goes out and people don't even know what she was talking about. Now, Neil, we've been trying to focus tonight on hospitals, and you're at Harvard Medical School, Massachusetts, Boston in particular, really a great hospital center. One of the questions that has been raised, the critics have raised about Obamacare, is the danger of layoffs at hospitals and jobs and doctors leaving the profession. What are you seeing and hearing?
Well, I mean, I think obviously in Massachusetts in particular, the healthcare sector is one of our largest employers. We were 7 years ahead of the rest of the country in terms of covering everybody, and that means that we're now 7 years ahead of the rest of the country in terms of running out of money to pay for it. So healthcare costs are very much on the minds of everybody in the state. In fact, we just had a big hearing on healthcare costs today here in the state, and whenever you talk about containing healthcare costs, there's a concern that it could mean something for employment on the back end. And everything that I'm seeing, all of the workforce projections are basically showing that we expect the opposite. The healthcare needs of society are growing. The problem is that the costs are just growing at a much larger rate. But the need for boots on the ground to sort of care for Americans is no smaller than it's ever been. And in fact, I think what we're going to see is more sort of what we call mid-tier providers. So not necessarily physicians, but more nurse practitioners, more physician's assistants.
Well, clearly there'll be more demand in addition to the baby boomers getting older, which will also increase demand. Andrew, under the current system, if you have insurance and you go to an out-of-network doctor, it ends up costing you a pretty penny. Is it going to get worse under Obamacare?
It doesn't necessarily get worse because of Obamacare, but it most likely will be worse for many people who sign up on these state exchanges. The reason is to control the cost, to control the premiums that people are going to pay for insurance on these exchanges. The insurance companies needed a way to lower their premiums. The only way you can do that is restrict the doctor network of the physicians and hospitals that participate with that insurance, and then say if you go out of network, you're going to have no benefit coverage. So I think you'll see a lot of plans on the exchanges that have no out-of-network benefits. And you know what?
Well,
I have that now. And it's a choice I made to lower my premium. And other people are going to have to make that decision as well.
Neil?
Well, I was just going to say the other piece of it is that not only might you have a little bit more restricted scope in hospitals, which, by the way, doesn't really mean anything in terms of quality. One of the things that we know is that there's a lot of lower-cost hospitals that perform much better than the high-cost hospitals in terms of making people healthier. But the other piece of it that we're going to see, I think, based on our experience here in Massachusetts, is that we're going to have a lot more Americans on these high-deductible plans where you're taking the first $5,000 on the chin. And so Americans, this is not necessarily something that's created by Obamacare, but it's something that's certainly not helped by it. Increasingly, you're going to see Americans get more and more price sensitive around healthcare because more of our own healthcare dollars are going to go into the services that we purchase.
And one final quick question to you, Andrew, and it is something we discussed about the hospital costs and all that stuff. I recently saw a report about just the enormous costs of having a child in this country and the kind of costs that were being put on people's bills. There was also a study about saline, which costs companies $1 to produce, and adults are being charged more than $700 for an IV. In that same maternity story, they were talking about aspirin. Hospitals charging over $100 to give an aspirin. Is that going to go away? Is that going to come under control?
It's really not going to go away. I mean, what you're talking about is how hospitals establish charges and what they get paid by the insurance companies. There may be more transparency in the future, but you would really have to transform the entire reimbursement system of how doctors and hospitals are paid, and I just don't see that happening in the short term. It's very difficult for the public to understand. It's very distasteful to see these kinds of things showing up on bills. I work for a hospital, I understand that, but there's a lot that goes in behind it, and it's probably worth looking at. It's just not part of this.
Even though we get such fabulous health care, when you look at numbers like what we talked about at the beginning of this, that in the U.S. it's $12,000 for an average stay, while in Germany it's only $5,000.
It's a complicated issue. Yeah, it's a complicated issue.
All right, Andrew, Neil, really appreciate you
hundreds
both.
of millions of dollars right now in the Silicon Valley to basically create a Yelp for healthcare, for whatever that's worth. So,
so you can go online and figure out where you want to go. All right, Neil, appreciate it. Thank you very much, Andrew. Really, thanks for being here tonight.